All right, so this is my discussion video. I don't know how I spaced out on it, and I'm not expecting a grade, but I do want to do the work. So my name is Jovan Ramirez, and I am in my last rotation for Psych NP, and I'm so excited. Describe your current position. If not employed, what are your expectations when you complete the program? So, my current position, I'm actually in transition right now. I have worked in a level one for 2 years. And then prior to that, I worked at a level one somewhere else. I've done corrections. Anyhow, I'm looking to transition into community health or do some teaching at a current college just to kind of reduce the stress and have time to prepare myself for my boards. And what are your expectations when I complete the program? I've had actually it's been a blessing. I've had some job opportunities with my prior employers, either at a level one or an addiction center. So I'm not sure yet. I think I want to concentrate on my boards for now, and then see what's out there. So, what are some specific topic areas that you are anxious about addressing in psychotherapy? Oh, I think it's those borderline ones. Um, those patients that there's just it's those patients that just there's just no boundaries. There's those topics where, like, they're racing thoughts, and they can't stick to one goal at a time or one suggestion at a time, or how to like bring them to understand what their needs are, because it's their needs. And I think that's always been something really difficult for me, even as a floor nurse, is those borderline personalities. Yet I've learned that setting boundaries has been the one thing that has helped. But in an outpatient therapy, if there are borderline, that would be my anxiety, is to learn to set boundaries on someone that just continues to. Maybe it is venting. Maybe therapy is a lot different. But it's that. It's like, okay, well, when you go around in circles in a conversation, you're like, wait, what are we doing again? That's the anxiety. What about these specific issues or topics are bothersome to you, and why? Um, just because I feel like I'm not getting anywhere. I feel like I lose track of what the issue is with borderline. And honestly, it's it weighs on you, because the more you try and the more you try to be empathetic, the more they cling, and then, in an inpatient, I've got 19 other borderliners. So it's learning. It's That's the anxiety. Are these topics essentially triggers on some level for you? Not necessarily. They're not triggers for me. They're just, I don't know how to help you if there is no goal. And how can you overcome these anxieties on your own to better assist clients? So, I've read a lot about borderline. In the beginning, it was just frustrating. It was just like, oh man, no, not gonna do it. And a lot of substance abuse is borderline. Because they're out to get something, and a lot of the time they're narcissists. They know how to get what they want, and you just kind of cave in and give it, or you just get frustrated. So I've learned through a lot of research that boundaries for me have been super helpful. Meeting them, establishing rapport, letting them vent, and then before I let them vent, I tell them we're going to talk about two things. And each thing is only going to have one thing behind them. So before we start, I want you to pick your two things and the one meaning thing behind each of them. And that has helped me a lot in a level one, because level one, they're just super, super, super manic and they're just all over the place. And then they know, and I know that this is where this conversation is going to go. And then the next time that we speak and we do an assessment, it's going to be the same thing. Either we can touch up on the two that we've talked about, or one of the meanings, or you can come up with two new things. And then about the third time, depending on where they're at, we start setting goals. So for every one thing that we've talked about, you have to tell me what your intent is to fix that thing. But I guess I'm not really anxious about it. I'm kind of curious to see how many borderlines come to therapy, or those that are not diagnosed where you're like, whoa, definitely. Um, yeah, I think that's about it. Again, I apologize. I don't know where I lost track of my video. Again, I'm not asking for a grade, but that I did do the work. And I will be posting it and sending it. Thank you. Have a great week.